The Jack Spring Electric Keel Newsmaker Hotline, the newest, the latest, the shiniest of those is Caddo Parish Coroner Dr. Todd Thoma. Morning, amigo. How you doing today? How's everything?
I'm doing good, Robert. How are you?
Are you busier? Are you?
Of course he is.
Is it just? Tell us about how this is affecting you and your office, first of all. At all? Or, I mean, you're the coroner, so I'm trying not to be too macabre. You know what I mean?
Robert, yeah, we're getting an uptick. I mean, needless to say that the deaths in Caddo Parish stay relatively stable year to year. Due to our population, we have approximately 3,000 deaths every year that the coroner's office has to work. That number really doesn't vary much. Well, in the pandemic, we're expecting it to go up a little bit. We don't know how bad it's going to be at this point in time. We've had several deaths in Caddo Parish already that we're having to deal with, but my people are still working full time, and I guess they're essential employees. Nobody's been furloughed.
This was going to be sort of my last question, but it popped into my head. I mean, I'm thinking, should I ask it first or last? What kind of protection? God, this is going to sound horrible. I apologize. What kind of protection do you and your staff wear if you're doing an autopsy on someone who died from COVID-19? Can you catch the disease from someone who is deceased?
Oh, absolutely. Yeah. I mean, actually, we're not autopsying most of these cases. I have not sent one for autopsy yet, strictly because of the risk that's involved. Most of these people have already been in the hospital. They've been on ventilators. They've been diagnosed in the hospital, and they die from the disease. When they do that, we handle the body like we normally handle the body, but we disinfect the bags and label them and make sure that the funeral homes know what's going on. Aaron Dutch, my chief investigator, and I visited every one of the funeral homes to let them know what our protocols were going to be and make sure that they had a protocol in place to handle these people, to make sure everybody that knows the risks. Now, needless to say, like everyone else, when we handle these patients, we gown and glove, we put mask on, we wash up afterwards, we don and doff the way we're supposed to. We were all trained pretty well to handle this when we did Ebola.
So pardon me, Todd. So funeral homes are having to take just as many precautions as at least on. Explain that to me.
Absolutely. I mean, the decedent still gets released to the funeral home. The funeral home makes arrangements for this. So if the family chooses to bury, then they're going to have to embalm like they normally would embalm, and then have to do whatever funeral that they do. Needless to say, they're not able to gather, so they're not allowing people to gather in situations like that. At a time like this, you see an uptake in cremations because they can't have a formal funeral and the biohazard risk that's associated with it. But yeah, we still have to take care of the deceased.
Todd, let me ask you this: 185 deaths as of noon yesterday in Louisiana, 5 in Caddo. Help me with this. Are you seeing some commonalities? I know you're talking to the other coroners. What are some key commonalities that are standing out in these deaths?
Well, Aaron, I mean, the commonalities are all across, they're the same all the way across the world. So, I mean, we've been able to look at these and know what's going on. We're actually up to 8 deaths in Caddo now. And all of them are people who are either elderly with a lot of medical conditions or younger with serious medical problems. We're not necessarily seeing it in the young, healthy people. They have a tendency to survive this better than the older people do. But that doesn't mean that they don't get sick. Approximately 15 to 20% of these people will require hospitalization and supplemental oxygen. So that's what's overtaxing the system. That's what causes the hospitals to be overtaxed.
This sounds very macabre, but what in the end is killing them?
Respiratory failure, and a small percentage, I shouldn't say a small percentage, approximately 25% are showing evidence of myocarditis or an inflammation of the heart. They are not able, their lungs get so damaged they're not able to oxygenate, and they just die from respiratory failure. It's mostly a lower respiratory pulmonary disease that they die from that.
Let me ask you a stupid question that medical people will understand. Maybe. Does the coronavirus get in the lungs and then start spreading throughout the lungs? I know that sounds stupid to you probably, but can you explain it where a moron can understand it?
Well, I mean, it's a total body infection, but the majority of what you see, majority of the damage occurs in the lungs. It goes in there, the virus goes in there, it attacks the lower parts of the lungs, and it can involve the upper parts of the lungs. And it goes in, attaches to the cells, and it destroys the cells. And as the cells die, the virus goes in and kills the cells. As the cells die, fluid seeps into the lungs, their permeability of the lungs go down, they get marked infection, they get wet. When they get wet, they're not able to transmit oxygen from the bloodstream into the bloodstream from the lungs, and you just aren't able to oxygenate anymore.
Is it just like real fast emphysema, for lack of a better analogy, just real fast emphysema, something like that?
Emphysema is a whole lot different thing, because what happens in emphysema is you don't have the surface area to transmit the oxygen. But yes, it's a lack of oxygen that happens because of this. This is because as you breathe in air, the oxygen has to go from the air into the bloodstream, and it goes through a very small membrane that's between the bloodstream and the air itself. Those get broken down, and there's fluid in there, and so the oxygen won't go through the fluid into the bloodstream, and you're not able to get oxygenation into the body. And basically, you end up with cellular starvation and no oxygen whatsoever, and they die from respiratory failure.
I have been wanting to ask a doctor this for about 5 days, and we're always pressed for time, but now I have you. How does a ventilator work? I mean, for the patient, how are you hooked up to that? Is there some, I assume there's some sort of physical invasion by the machine? What exactly happens?
It's a tube that goes down through your mouth into your trachea, okay, the main area that goes down into your lungs. And the machine actually forces air in and air out and air in the same way that you would normally breathe. But with a ventilator, they're able to do a lot of different things. They can monitor pressures. They can maintain certain pressures associated with it. They can maintain what we call your tidal volume, how much goes in, how much goes out. The ventilator can just be dialed in and it breathes for you. Which is great. I mean, because for people that can't do that, this is the way to be able to do it. But even with these people, what ends up happening is you have to go to higher levels of oxygen and higher levels of oxygen and higher levels of oxygen to where eventually you're on 100% oxygen and still not able to ventilate. So it's a miraculous machine. We've been using them for decades and decades and decades, but they keep getting better and better. Needless to say, as all biomechanical tools do. But thank God we've got them.
One more question in our last minute or so. You would think, and I'm surprised to hear you say you're not doing the autopsies, because you would think during the autopsy you might learn more about this virus. Is that not accurate?
No, it's not accurate. I mean, we know what these people are dying from. We do the test. I mean, the CDC has autopsied tons of these. I mean, if we end up with 100,000 or 150,000 deaths in the United States, it's an unnecessary risk to put all the healthcare providers at risk for doing 150,000 autopsies. Like I said, so many have been done. We know what the pathogenesis is. We know what the damage is. And it's not going to give me any more information. I can't go in there and just remove part of the virus, and my virus is going to be any different than the virus that occurred in India or China or England or northern United States. Okay. So the bottom line is they test a certain amount of these until they get all the information that they need. But at a certain point, you're not going to. The risk to the individual and the healthcare people is higher than the amount of information you'd get out of it.